Atrial fibrillation is an arrhythmia, a heart rhythm disorder that originates in the upper chambers of the heart. And patients that have this typically will experience rapid heart beating, irregular or chaotic heart rhythm, and this can often leave them with shortness of breath, fatigue, or just poor exertional tolerance in general. It also increases stroke risk. Atrial fibrillation is more common as people age, but that does not appear to be gender specific. Women do naturally live longer than men, so many of them ultimately develop atrial fibrillation as they get older, but it's not more likely in one sex or the other. Well, there are several classes of medications that should be used for the treatment of atrial fibrillation. Most importantly are blood thinners or anticoagulants. Of all the therapies for atrial fibrillation, this is the only one that's been demonstrated to extend patients' lives, and it is because of the reduction in stroke risk that we achieve with that medication. Many patients are placed on antiarrhythmic medications that are specifically designed to keep the patient in normal rhythm and limit the amount of symptoms they have. But the latest guidelines from the Heart Rhythm Society say that ablation may actually be now offered as first-line therapy to some patients. So medications may be slowly going away and ablation may be coming to the forefront. This is basically a minimally invasive technology where we go in through the groin, up into the heart, and cauterize or freeze some heart tissue to try to eliminate the source of the arrhythmia, of the atrial fibrillation. The tools that we need for this are quite complex. The procedure has to be performed in the hospital, and we have a complex three-dimensional mapping system where we actually map the interior of the heart with a catheter, a little plastic tube with metal electrodes on its end. And we have several specialized personnel that assist us in this process. Some work for the hospital, some work for different companies that provide us with these tools. And as a team approach, we make all of the appropriate ablation lesions that are needed to safely eliminate the arrhythmia for our patients. Currently, there are two different modalities of ablation that have been approved by the FDA for use in the United States for atrial fibrillation. The first and the more conventional method is called radiofrequency ablation. This involves delivering heat energy to the heart tissue in order to create the ablation lesion. The second is called cryoablation, where we basically have a catheter that has a balloon shape on its tip, which cold gas is fed through in order to make a freezing lesion of the heart tissue. The results are similar in that the heart tissue is actually damaged to the extent that some scar tissue that is electrically inert and blocks the action of the atrial fibrillation circuit is created. September is actually Atrial Fibrillation Awareness Month, and there are many patients that have had atrial fibrillation, some of them for many years. But the technology that we can now use to treat this disease has improved significantly just in the last several years. And if you have any questions about whether or not ablation or other advanced technologies might be applicable to the treatment of AFib for yourself, please ask your physician, especially a cardiologist or even cardiac electrophysiologist, about whether or not these new technologies might be appropriate for you.